So having extra testosterone increases the amount of red blood cells you have, which can thicken up your blood, lead to a blood clotting risk. What do you recommend to help mitigate that? And this is actually very easily detectable with
Yeah.
like a standard complete blood count. It's like a $5 test. You get hemoglobin, hematocrit, red blood cell mass, a few other things. How do you think about mitigating that if it's too high?
Yeah, so that's like, again, one of those things that's very predictable. We know that's going to happen if you're increasing your anabolic dosages. So one is like preventing clotting, right? It's like one is just like things like fish oil and nattokinase and maybe a baby aspirin, things like that, to just like try and prevent the clotting risk. And the other one is actually lowering the level, which would be maybe going and donating blood or something during those phases where you know your dosages are elevated and it's like an acute thing. Then maybe every 8 to 12 weeks you could go donate some blood to just lower it immediately.
Got it. That makes sense. Yep. I like those two. Nattokinase, it's interesting. It doesn't quite work the same way as aspirin does. I looked into this a little bit. I think if you're getting nattokinase, you probably also want to check your actual blood clotting factors. So there's one called PT, there's one called PTT, and there's something called fibrinogen. The blood clotting cascade, have you ever looked at it? Have you
No,
seen it?
I haven't.
All right, I'll show you this really quickly because I think you will appreciate. Well, anybody will appreciate the complexity if they look at it. There's a lot of stuff going on with blood clotting. There's like 13 different factors. So here you go. This is just like a random website I found, but this is what we have to memorize in med school. There's two like main pathways: this intrinsic pathway and this extrinsic pathway. So I forget which is which, but PT measures one of them and PTT measures the other one. And then you get down here with fibrinogen is kind of a common pathway towards the end that leads to the eventual blood clotting. So nattokinase attacks this fibrinogen here, but you can measure basically how is this clotting function working, how is this one working, and then how's it working right at the end there. And you could try to make sure that it's not going, you're not overdoing it. Essentially, it's a way to mitigate the nattokinase. Now, aspirin works in a different way where this is like these little protein factors in your blood, and then you have your platelets which can start clumping together, and they help cause like the plug essentially. So it's kind of separate from this whole process, and that's what aspirin helps. It helps prevent those platelets from sticking together. So you wouldn't see it here, and there's no like real way to test for like how much aspirin function you have. With any of these, I also think it's really important. Just like if you're bleeding and bruising easily, then maybe go get it checked or maybe back off some of these.
Yeah.
Is that something you hear about with athletes where they've noticed?
No, I haven't. Yeah, that's why I feel like the benefits of taking those is probably outweighs the risk of it. But yeah, I haven't really seen much of that where people are bleeding too much or whatever. Because even if you get your blood drawn or blood taken, then because you're not supposed to take like blood thinners and stuff when you do that, right? But typically, I think it just returns it to baseline or something, because like otherwise your blood would be really thick, and you take these things and then it flows like normally. Because even with a pretty high hemoglobin, I think if you're taking like a baby aspirin or a lot of fish oil or something, your blood still flows fine when you're donating it and stuff.
Yeah, and just as a minor thing, like the hematocrit is really the one. I mean, both matter, but the hematocrit is the one that refers to like the thickness. It's like the percentage of your blood that is solid versus liquid. That's what the
Okay.
hematocrit is talking about. But you're right, the hemoglobin is like a factor of that, as well as like the red blood cell mass, and that makes sense. I'm not 100% sure of like how much each of these factor in, but I think certainly if you start bleeding easily, then look into it. And the other thing I would look out for is if you just are on some of these compounds and you have like head trauma or something, I would just be extra careful because you want to make sure that if you have a brain bleed, you have to be really careful because that can be life threatening. And patients who are older, like people who have heart disease, we put them on baby aspirin because it helps prevent the clotting that can happen if one of these like cholesterol bits breaks out of the side of your blood vessel and it gets into your bloodstream. It triggers like a clotting reaction and rapidly fills up the space in your artery, blocking off blood flow. And there actually was a recent article going around because President Trump, he's over 70, he's on a baby aspirin, and there's some evidence that says if you're that old, it's not worth it because the bleeding risk outweighs like the risk of the clotting. Right. But he's over 70 for a 25-year-old bodybuilder. Like this is like the bleeding risk is much, much lower. So I agree with you that you don't have to worry about that too much.